162 residents of long-term care facilities have died of COVID-19. After reported problems, the state now says partners will work together to improve communication between facilities and families of residents. CBS 4's Kelly Rinke has the update on the push for transparency tonight.
We now know there have been more than 1,500 cases of COVID-19 inside the state's long-term care facilities. What we don't know are the sites, and that's because the state will not release their names.
It is their responsibility to provide us with this information.
Erica Reichard works for the Center of At-Risk Elders, a nonprofit law firm who advocates for older adults. Most of their clients live in nursing homes. She claims receiving information on COVID-19 cases at facilities is sometimes difficult.
It's definitely a case-by-case basis in that regard. I would say that obtaining state numbers has really been a challenge.
That's why her group is considering filing an open records request to learn the names of facilities with confirmed cases.
I understand what a challenge this current climate is, but please partner with us advocates.
State Health Commissioner Dr. Christina Bach says right now Indiana will only release statewide totals on a weekly basis. She believes this is a personal matter between the facilities and residents and their families. Today, we asked Governor Holcomb to explain why the state will not publish this information. He deferred our question to Dr. Box.
100% respect the transparency and the knowledge and information that needs to be shared. And so we are working very hard to make sure that that occurs for every single resident's family or contact individual.
Dr. Box says ISDH is working with state partners to create guidance for facilities regarding information that should be communicated to families.
HIPAA applies to individual protected information. It does not apply to corporate information.
One company is naming their facilities that have COVID-19 cases. They operate Bethany Point in Anderson, where 30 residents have died of COVID-19. On their website, Trilogy Health Services names all of the Indiana sites with cases, listing the number of employees and residents who have tested positive. Other companies will not give me those numbers. In an email, a spokesperson wrote, "The media's attention on those numbers stokes fear and uncertainty about the care being provided in our centers." He also said it creates anxiety for their residents.
Does AARP believe that releasing the names of facilities would violate someone's privacy?
No, we do not believe that.
Sarah Waddle is the Indiana State Director of AARP. She spoke with Dr. Box on the phone yesterday, and they talked about the concept of releasing the names of facilities.
I think that would be something that we would continue to talk about if we were continuing to hear that there are issues.
In Indianapolis, I'm Kelly Rinke, CBS 4 News.
If you're concerned about the safety of a loved one who lives in a nursing home, AARP wants you to contact the public advocate for long-term care facilities. Call 1-800-622-4484.